Good afternoon, everybody. Here with Josh and Paul and Scott Gottlieb, our great friend, our advisor, Connecticut's very own, former head of the Food and Drug Administration, and on the board of Pfizer. As you remember from our meeting on Monday, Pfizer's first out of the box with a vaccine that could be a game changer. Before we're there for questions, let me just give you a quick summary of where we are. What's interesting here, 24,000 tests. We're running at a rate of 200,000. Given the ramp up in infections around the country and in our state, we're bringing in the reinforcements. What we can do in terms of testing, we're in the top 5 in the country, and we're going to keep that up. And 98% of everybody who gets tested, we're getting results within a day or so. We're able to track and trace about 98% of them, which is pretty good, but it's not good enough, and we're still working really hard to keep up. The positivity rate of 4.8%, we've been bouncing around a little bit, but it's trending up. The 7-day average is 4.4%, so it gives you an idea of what the trend is like. Hospitalizations, 33. That's a number I'm watching carefully. We've doubled the number of people in hospital related to COVID in the last 2 weeks. 617 you see right now. Less likely to be in the ICU, the intensive care units, more likely to be in the hospitals. As I've explained before, we're able to expand capacity of our hospitals, build up those field hospitals. Our amazing Connecticut Guard, we can do that within 48 hours. Working really hard on nurses and other specialists to make sure we have the backup, because that could be a real need. We've seen that around the country. Last time around, we could bring in nurses and specialists from elsewhere. There is no elsewhere right now. Let me take the next chart. You can see the red alert status is true of about 100 of our 169 towns. That's about 80% of our population. What's the good news there? Eastern Connecticut's doing a little bit better. New London and Groton bringing in the reinforcements. They brought down the positivity rate there a little bit. I guess that's a positive. If you're in Roxbury or Scotland or Sharon, you're in the white. There's not many, but go to ct.gov. You can see if you happen to be in one of those low infection areas, but there's not many. I'm afraid that Bridgeport is probably the area that's being hardest hit right now in terms of the infection rate. And this is why we're using our protocols on a statewide basis. It's a statewide issue, and we're working closely with our neighbors, as I'll explain in 1 minute. What else can we do? We explained in the next chart the COVID alert. And right now, our track and trace is if you test positive, we'll reach out, find out who else you've been in contact with. It's a way, if you tell us, that we can keep your friends and family safe and narrow the spread. The COVID alert is a smartphone applications. You heard Josh talk about that, probably a month ago. We've been out there testing it in our colleges right now. It's a smartphone app, and it provides immediate notification if you've been near someone who has tested positive in the last 14 days. We're the first in New England to do this. Some of our states, like New York, have been doing this for a while. We wanted to learn from their example. Completely anonymous. Completely anonymous. You'll be notified on an anonymous basis. I think that's really important to give you confidence that you want to download this app. And if you do get alert that you've been in contact with somebody, you'll get instructions on testing, quarantine, where you can get tested, and reach out to a contact tracer, or they'll reach out to you to get a little more information from you. So how do you do it? That's on the next chart. All right, for Apple users, it's not that tough. I mean, even I could do it, so that tells you something. On your iPhone, you go to the settings and go to exposure notifications. Right there, you can get that downloaded in 1 minute. If you have your iPhone, go to settings, go to exposure notifications right now, And same thing for the Android users. Go to the COVID Alert CT app. It's part of Google Play. I urge you to do this. I urge you to do it now. It is exponentially more effective if each and every one of you, download this app. If only 5% of your friends do it, you're not going to be noticed. If 90% of your friends do it, you're that much safer. That's why we're urging you to do this. We've been testing this in some of our colleges over the last couple weeks. It's working. The next chart. It's 14 days to Thanksgiving. We knew that November was going to be a tough, complicated month. We knew it was complicated because of lines and elections. We knew it was complicated because of flu season. We know it's complicated because of Thanksgiving and the holidays. And I need you to be cautious a little bit longer. First and foremost, all of our colleges, we're giving them the protocols. Please test before you get on that plane, quarantine before you head back to wherever you're from. And I urge the same thing for each and every one of the colleges and our kids coming from elsewhere. Paul is working very closely with our neighboring states, setting out clear protocols to all those colleges. This is what you want to do. I'm also looking at this demographically. People over the age of 60, stay safe, stay at home. I know you heard that before. You're going to hear it again. It's by far the safest thing for you and your family. We're going to talk to the supermarkets, maybe give an extra hour so you can go and shop safely at a special time, because some of those are getting quite crowded right now. 10-person gatherings. I know that's tough for Thanksgiving. And in a few minutes, I'll tell you a little bit about some of our protocols when it comes to schools. But first, let's take your questions, unless, Scott, you'd like to say something first.
No, Governor, I welcome the questions. I just turned on the COVID alert, so I'm now part of the contact tracing.
Wasn't that tough, was it?
And you're right, it was quite easy.
All right, Max.
Channel 3 Eyewitness News.
Yes, Governor, a question about testing. We are seeing a lot more testing, but along with the spike in cases, we're hearing that in some places there are now wait times or instances where people are needing to wait days to get tested. Is the state aware of these issues, and how widespread is this?
Why don't you take that, Josh?
Yeah, we are aware. Despite, as the governor mentioned, we're running over 200,000 tests a week, which makes us top 5 in the nation in testing per capita. We have seen a surge over the last few days, and we are seeing some lines at certain testing sites. So we're taking a lot of actions. We've been working with our testing partners. We've actually added 30 new testing sites over the last 2 weeks. We're well over 200 testing sites around the state. We're increasing the hours that they're open. We're increasing, making sure that they have coverage on weekends as well. We're also helping them expand, both with financial supports from the state as well as staffing. We're deploying 50 National Guard members to help deal with some short-term staffing crunches in a couple of sites. So we're moving very aggressively on that, and we look to get those lines down quickly. The bottleneck is really at sample collection. It's not in the laboratories. We have plenty of laboratory capacity. It's really getting people swabbed, getting those samples off the lab. So we're working to expand that even faster.
Perfect. Got it. A real quick question for Dr. Gottlieb about the travel advisory, because for the first time ever, when we're looking at the COVID exit strategy map, nearly every state is in that deep red uncontrolled spread category. So the question is, if we're all in this uncontrolled spread, are the health risks for people, traveling home from college or people traveling for Thanksgiving, is the risk as great as it would have been if there were still pockets of the country that were doing well?
I think the risk is greater right now because we have a situation right now. I mean, the Northeast is doing well relative to other parts of the country, but we have a situation right now where we have a lot of spread everywhere across the country. We always worried that as we entered the fall and winter, we would see a more confluent epidemic. What we've had so far is regionalized epidemics. The first epidemic was largely centered in the Northeast, then we saw a wave of infection sweep the South. Now what we're seeing is a truly national epidemic where every part of the country is going to be simultaneously engulfed in infection. It started in the Midwest. It sort of transferred to the Great Lakes region. But now when you look across the nation, you see a fair degree of spread everywhere in certain states that are really hard pressed right now. A lot like the flu season. The flu season typically starts as a very regionalized epidemic, and then eventually it becomes a more confluent epidemic across the whole United States as the flu season progresses. That's what we're likely to see with coronavirus right now, a very difficult 2 or 3 months. I'll just make sort of one final point. This is really the sort of 8th inning, if you will. I think this is the final stage of the acute phase of this pandemic that we need to get through. Unfortunately, it's going to be the hardest phase right now. We're in for a very difficult 2 or 3 months. We always thought that the fall and the winter would be the most difficult period with this virus. This is a respiratory pathogen that would typically spread in the wintertime. Now we're in that winter. We've taken steps to, return to school, go back to college, go back to work. We're huddling indoors because it's cold out. So all the things we're doing is going to be conducive to that spread. We will get through this. And I think as we enter 2021, we're going to have a lot broader technology to try to mitigate this risk. I think 2021 is going to look a lot different than 2020 did. But we just need to try to, take collective action and do as much as we can to try to slow the spread, preserve the healthcare system, and preserve life over what's going to be a very difficult 2 or 3 months, the final stages of the acute phase of this pandemic.
Perfect. The final one for me is just a clarification of the suspension of interstate sports. We know that teams cannot cross borders to play, but does this apply to specific players? For instance, a player lives in Springfield, Mass, but plays for an Enfield team. Is that still allowed?
Yeah, I'll take that question. Basically, how this applies, remember, this one is particularly for hockey, even though the state of Connecticut has put forth for all sports that we will limit our teams or teams of any sports in the state going to play tournaments outside the state, and also limited that there will be no out-of-state tournaments, basically teams from out of the state playing in the state. So basically this means if you play the sport of hockey, for example, and there's a tournament that's occurring in Springfield, Massachusetts, you will be staying in the state of Connecticut, as Massachusetts also will not allow that team into the state to play hockey.
NBC Connecticut.
Good afternoon, Governor. On March 30th, our hospitalization rate was 517. That's 100 less people than it is today. Of course, we were shutting down at that time. Why aren't we shutting down now, other than the fact that it would be fairly unpopular to do so? Why aren't we shutting down non-essential businesses and schools again, just to get our numbers back to where they need to be?
I think we're finding that workplace, stores, we can manage those and keep them open safely. Although I am hearing stories about some of the, grocery stores are getting pretty crowded. We got to monitor the people there very carefully. As we said before, most of the spread is related more to the social interactions, but your point is well taken. Those, as the spread moves more to the community, it may impact some of those places that were not spreaders before. We're watching that very carefully with hospitalizations as a key metric.
And secondly, how long are you going to give the rollback to work, the one that you put in place last Friday, before you go into the next step? And what are your contingency plans? I mean, what is the warning you have for people who don't want to wear masks, who don't want to avoid social gatherings, about what you're going to do next if these numbers continue to rise?
It's not a warning. It's you've got to wear that mask. If you're inside, you can't social distance. You're in a public place. You're in a store. You must wear that mask, or you are subject to a fine. In terms of contingencies, look, we're watching very carefully. We've got the infections, for example, in our schools have gone up over the last week. We're following that pretty closely. Much less so for in-classroom education, but much more so for students more broadly. I'm noticing when I look at schools, because that would probably be something we want to keep open as long as we can. I'm looking at Europe and other places where they've successfully kept their schools open despite much higher positivity rates. But you're right about, also I look at those other places, they had to do things with restaurants and fitness centers, and we're going to be watching that carefully. May have to make some changes if this curve doesn't bend.
Thank you.
News 8.
Hi, Governor. There is a new report out from the Health Department about clusters. They examined 69 clusters, and it shows restaurants are responsible for a lot of that. Workspace is also the top two transmission risks. And we're looking for a little clarification of restaurants. Is that like busboy to dishwasher, or is that more patron to patron in the restaurants? And workspaces, if those are the two, we were always told family gathering, home is the third. But we see restaurants ranking higher and workspaces.
I think they are higher than workspaces. You're absolutely right. Restaurants, of course, you're not wearing the mask. As you know, we've ratcheted that back till 9:30 just to make sure that we keep it properly there for eating only, and we're going to have to take other precautions as needed. But Scott, do you want to comment on that? The question was in particular about those high-risk activities like restaurants.
Yeah, I think the highest risk activities, Governor, to pick up on what you were saying, were places, indoor settings, congregate settings indoors, particularly where people can't socially distance, where people aren't wearing masks. And so restaurants would be high on the list in terms of a setting that's going to be a high risk for spread. And what we see is that this is a virus that transfers predominantly through respiratory droplets, but under certain optimized conditions, you get a pattern of spread that looks much more like aerosolization. So this isn't binary. People say, is this an aerosolized virus like the measles and it can stay suspended in the air for a long period of time? Or is it something that spreads through droplet transmission like the flu? And the answer to that question is that it exists on a continuum. A virus that typically will transfer through droplet transmission, which is what this virus is, under certain perfect conditions will approximate a pattern of spread that looks much more like aerosolization. So what are those conditions? It's a confined space. It's a space where people are talking loud or singing. It's a space where you might have dry air, so you have an air conditioner on or a heater that doesn't have proper filtration. Maybe the person who's infected is positioned right in that space to spread around their respiratory droplets or their aerosolized respiratory what we call droplet nuclei. So restaurants, other confined spaces like that become, in certain cases, optimal conditions for these sort of super spreading events that we see.
And with workspaces being high second, is that something you're looking at asking people to go home again?
Right now for work, look, if you can telecommute. If you're over 60, stay at home. But I have not seen that high incidence in the workplace, especially if all the protocols. But, you know, as Scott was saying, not only restaurants, because you maybe don't have the mask on, but places where you sing, perhaps the houses of worship we found to be relatively risky. We've got pretty strict protocols there. And fitness centers, they were sort of the top three of the analysis that we were looking at.
Okay. And then last question, schools. It seems to us that the unions are asking for uniformity across the state. You have different districts kind of trying to figure it out on their own, and different things aren't working as well for other districts. Are you thinking of stepping in uniform, making it uniform?
I don't think so. Look, I think our schools have handled this very well. Every situation is a little bit different. My thinking on it is, obviously the seniors are a special category when it comes to risk. When I think about younger people, I think about university students. That's why early on, with help from Scott Gottlieb and others, we put in place a university plan that anticipated the universities shutting down before Thanksgiving, not reopening until February. When I look at K through 12, I think that the high schools are more at risk perhaps than the youngest grades, as I said before. I think people are already making some changes where you're much more likely to be hybrid in the high school situation. But pre-K through 5, a majority are still going to school full-time in class. And that's an appropriate mix, I think, as you see going forward with the infection rates changing, doing everything we can to keep those youngest kids in the school, least likely to shed the virus, least likely to have complications. And we're working hard maybe to get some younger teachers out of the teacher colleges, maybe to be able to help in the classroom to get us through this calendar year.
Thank you.
News 12 Connecticut.
Hi, everyone. Dr. Gottlieb, I think we all sort of perked up when you said we're in the 8th inning of this and 2021 is going to look a lot different. Can you kind of expand on that? How do you picture next year playing out?
Well, look, we're going to have a dense epidemic right now, and I think the question is how long will it last, and where will we peak out? But we've seen these epidemic curves before. We know what they look like. We go up the curve, we come down. The more that we take mitigation steps to try to keep the peak of that curve lower, to try to preserve healthcare capacity, we actually extend out the length of time that it will take to get through the epidemic. If we did nothing, the virus would course its way through the population more quickly, but it would end up infecting a very large percentage of us and cause a lot of excess death and disease. But as we get into, the later winter, we'll probably be coming down that epidemic curve at some point late January into February. And as we get into the spring and the summer, we're going to be not only coming down the epidemic curve, but we're going to be entering the season when a coronavirus typically doesn't circulate. So there'll be a seasonal backstop of sorts as we can start going outside again. And that's going to be combined with two other factors. Number one, we'll have infected 30 or 40% of the population at that point. And so once you get that many people infected, the rate of transmission does start to slow. And we'll have a more wary public. I think people, progressively through this epidemic, as much as people are getting exhausted, they're also getting smarter. And so even people who are not being as cautious maybe as they were at the outset, they're doing things differently that is instilling more care in terms of how they live their daily lives. And so we'll have a more aware public. Against that backdrop, we do have technology coming out. I'm on a board of Pfizer, which announced results of their vaccine and interim analysis with their vaccine earlier this week. Moderna, another developer of a vaccine, is set to announce interim data on their vaccine. We've had an authorization of the first monoclonal antibody by Lilly. There's going to be others. These drugs should be effective, especially when used early in the course of disease. And so as we enter 2021, we're going to have a much different therapeutic toolbox. We hopefully will have vaccines that we'll start making available to high-risk populations and successively making available to broader and broader populations until we're ready to mass inoculate the population generally, which is hopefully going to happen at the end of the second quarter of 2021, maybe the third quarter of 2021. We're going to have more supply of these antibodies coming on the market, and different antibodies, some of which look very effective, like the Lilly cocktail, which isn't going to be widely available this year, but should be available next year. And that looks to be a very effective drug. And there's also some small molecule drugs, some pill form drugs that are in development as well against coronavirus. And so we should have a much different therapeutic toolbox. And so you're going to have a combination of a population that's been heavily exposed to this, and so rate of transfer will come down. You'll have the benefit of going into a season when it's less likely to spread, and then you're going to have a backdrop of more therapeutics. And so I think as we enter the summer, it should be relatively quiescent, I'm hopeful. And then as we get into the fall, and the coronavirus wants to start circulating again because it's a respiratory pathogen that likes to circulate in the fall and the winter, at that point we'll be ready to roll out a vaccine to mass inoculate the population. And if these vaccines maintain the level of efficacy that they've demonstrated in some of the early trials, we saw greater than 90% efficacy in the Pfizer interim data, and the side effect profile continues to look reasonable relative to, similar to what it's been. This is a vaccine that could potentially have a population level benefit. So hopefully it won't just prevent people from getting symptomatic disease if they get infected, but the great outcome would be if it prevents some people from getting infected in the first place. And for those who do get infected, it decreases their chance of passing on the infection. So it lowers the chance that someone who gets infected will go on to infect other people. And if it is able to obtain that, and that's what we should be looking at in this clinical data, but if we are able to achieve that with these vaccines, with one or more of these vaccines in development, then the vaccine becomes a tool not just to help lower morbidity, lower death and disease from COVID, but actually prevent transmission of COVID, affect transmission dynamics, and have a more population level benefit.
And Governor, I've just got two questions for you real quick. First off, in terms of this contact tracing app, how do you convince people to use it and trust it? We've heard in other states people aren't really using them that much.
I think maybe it depends a little bit on the demographic, but your basic point is right. The therapies that Scott's talking about, the vaccinations, track and trace, the only work if people are willing to use it. That's one of the reasons we created the vaccination advisory group, to give people confidence, folks from your community, to tell you what we're doing, why you should be doing it. I wanted to, talk about the app today, just to give you an idea of the ease of use. And but it's the safest thing you can do, not just to keep yourself safe, but your family safe and your friends safe. If you all do it together, you keep each other safe.
And my last question for you, Governor. The Democrats in the legislature rolled out a potential public option plan today. Are you supportive of that idea? And do you have any concerns about, it not bringing in enough money and taxpayers being left holding the bag?
Well, look, I'm really supportive of the idea of more affordable, accessible health care. If we've learned anything else, we didn't need to learn it, but this pandemic has reminded us you cannot leave anybody behind when it comes to public health. And that poor person who doesn't have health insurance and doesn't think they can get tested or doesn't have a home, they're not just infecting themselves, they're infecting a community. So I think we're reminded of that. So look, I salute the legislature for standing up. Talking about affordability is a key component. Talking to some of the entrepreneurs, the insurance entrepreneurs here in our state, they're rolling out a couple of programs of their own we're going to hear a little more about. And I look forward to working with Controller Lembo and the legislative leadership together to see what we can do to give our citizens more choice when it comes to affordable health care, not just for the individuals, but I come out of small business. I know what a hit that was for small business.
But one of the things Kevin Lembo said was, the state of Connecticut is the backstop. Are you worried that means that taxpayers are going to be footing the bill if this thing doesn't make enough money?
Yeah, I don't want the taxpayers to be the backstop of anything, which suggests why it has to be incredibly carefully designed so that the taxpayers are not the backstop. But look, we're pretty early on, I think, right now in terms of how this is going to be set up. What I love about it is it's a wake-up call. Here we are again, in the middle of a pandemic, the importance of health, the importance of more accessible and affordable quality health care for everybody. And I do want Connecticut to continue to be a leader there.
Fox 61.
Hi, Governor. We're hearing a lot of feedback, some for it, some against it, regarding talks of the U.S. lockdown of 4 to 6 weeks in order to control the pandemic. What are your thoughts on this take?
I don't think there's appetite for a long lockdown. I think there is an appetite to do things we can to mitigate the spread of this, to do everything we can to get back to the new normal. Scott said to get through the 8th inning so we can, get on the backside of this. I think we found that we've got some more tailored responses. I talked about a little bit in terms of education a few minutes ago, ways that we can perhaps keep our restaurants open longer, make sure that our businesses can stay open and still do it safely. But at the end of the day, if the metrics change and we find we have capacity issues in our hospital, we'll have to get even stricter.
Next question. So it's a voluntary app, but can you briefly explain some of the safety features, including that Bluetooth technology, to those that are wary of downloading an app they think is tracing them?
What do you think about that, Josh?
Sure. So Google and Apple, they've designed this with security first and foremost in mind, knowing that people could be skeptical about those issues you just raised. And it's also a reason why in Connecticut, we did not want to be an early adopter. We wanted to wait and let, now 10 other states have gone live with this functionality and have not heard any issues there. So just to be clear, the app is not tracking your location. It's not tracking any personalized information about you or the people that you're in contact with. It's completely anonymized. And if you are notified that you've been in close contact with someone who's tested positive, it will automatically give you instructions about things you can do, but you will not hear from anyone. It's only if you reach out to a contact tracer that we can provide additional supports. But in the meantime, it'll give you instructions about how you can self-quarantine, get tested, and keep yourself and your family safe. But it's completely anonymous, and people should not have any hesitations about downloading it. And as the governor said, it's just another tool in our toolkit to try to keep people safe.
WTIC 1080 News.
Hi, Dr. Gottlieb. You said people are getting smarter about this. We've been talking a lot about COVID fatigue. There's still COVID deniers. There's actual anti-mask activists, and the White House is a hot spot. So how are people getting smarter about this?
Well, some people are getting smarter about this. Look, I think people are getting more aware of the risks. I mean, some people are going to choose to deny the risks. Some people are going to choose to diminish the risks. But I think generally people are becoming more aware of the risks and more aware about how to keep themselves safe. And so for individuals who want to try to keep themselves safe, I think more people are building that safety into their daily lives, into their routine. That doesn't mean everyone. You know, if we had more universal adherence to masks, if we had more universal adherence to distancing, we wouldn't be facing the challenges that we're facing. But, you know, even marginal improvements in adherence to things like wearing masks, like wearing high quality masks, like taking precautions in your daily lives to diminish your mobility, reduce shopping trips, things like that. When you aggregate those small improvements over a population, it starts to have a profound effect. And that's why, as public health officials, we work so hard just to make small increments of gains in adherence to some of these measures. Because if you can get, for example, vaccination rates up, 5%, it doesn't sound like a lot, but that has a profound impact on the rate of transfer of disease. So I think people are getting more aware of how to keep themselves safe from COVID for those who want to. In the beginning, we weren't sure how to do that. We, for example, probably overemphasized the risk of contaminated surfaces relative to the risk of respiratory droplets. We didn't really fully understand the risk that this virus can be aerosolized in certain optimized conditions, like a confined space where people are talking loudly or singing. So we didn't really understand the settings that were the highest risk. Now, through effective contact tracing and the other things we've learned, we understand those risks. And the governor talked about schools, for example. We understand now better that young children aren't the same risk of being sources of community spread. We adopted at the outset of this pandemic an influenza playbook that was largely modeled off of the plans that we put in place back in 2002 and 2006 to try to mitigate the risk of a pandemic flu. And that pandemic planning always put schools and shutting schools at the center of our response, because in the case of pandemic influenza, children are a major source of community spread. And there's evidence showing that when you close the schools, you lower community spread. That's not the case with coronavirus. We've learned that now. Children aren't a major source of community spread, especially young children. And so we shouldn't put schools at the beginning of trying to shut down and lower community spread. We should probably put closing schools last, or later on, because we want to try to keep children, especially young children, in the classroom because of all the social and educational benefits.
Thank you.
The Associated Press. The Connecticut Mirror.
Hi, thank you, gentlemen. Dr. Gottlieb, at this point, what is the point of state-by-state travel advisories, in your opinion, as the states all seem to be having a surge? Should the advice be just generally trying to avoid contact with other people, as opposed to, again, what is the significance of crossing a state line at this point?
Well, I think the advice should be to try to avoid travel and try to avoid movement. What we've seen is Google mobility data has tracked very closely with these epidemic waves. When mobility increases, you see the rate of transfer increase. And in fact, if you look at some of the models built by IHME and other groups, they now overemphasize mobility data as a tool to try to predict future trends of the virus's spread. But there are certain states that are worse hotspots than others. There's no question about that. And so I think understanding which states have particularly high prevalence of infection and trying to avoid those states, I think is prudent at this point, because there are states where the infection rate is exceedingly high. Parts of the Midwest, parts of the South, parts of the West, parts of the Great Lakes region. I mean, the Northeast so far is doing better than other parts of the country, and the Mid-Atlantic region to some extent as well. I think you have a combination of a more aware population, better adherence to things like masks, higher overall exposure from previous epidemic waves, and more aggressive policies. You've had policies in place that have controlled spread, so we went into this with less spread, and you've had governors that have taken earlier action to try to keep up with the increases in spread. You also have a lot of testing in this region. You look at the states that are in the top, the governor talked about Connecticut being in the top 5 of testing. Most of the states that are in the top 5 of testing happen to be in the Northeast, and I don't think that that's an accident. More testing turns over more cases and allows people to self-isolate and take prudent steps to prevent themselves from spraying the virus to people they care about.
Yeah, Mark, if you're thinking of going to South Dakota for Thanksgiving, I'd think again.
The Hartford Current.
Hi, my first question is for Dr. Gottlieb. You were on this call in, I think it was August, and talked about sending students to school to start the year with the possibility that they would have to be sent home, or even the likelihood that they would have to be sent home at a certain point. Do you think we're at that point now, and does that framework still hold for you?
I don't know that we're at that point right now. I mean, you're seeing rising cases in the schools. There's no question about that. In my local school district, we've had 12 cases in the last 24 hours. I think Halloween had something to do with that. I think parents brought kids together for Halloween, and that has led to some of the outbreaks that we're seeing in the schools. I think we should try to do everything we can to preserve in-class instruction, particularly for K through 5 for the elementary kids, where I think it's more possible to lean forward and take a little bit more risk, understanding that the kids are less likely to spread the infection at that age and also less likely to have a significant outcome from the infection. But at some point, we may have to go to a distance model. I think the more we can keep kids in the classroom, the better. We should absolutely be taking steps to make sure we have a spring school semester. I see no reason why, as we come off this epidemic wave that we're going to go through right now, we shouldn't be able to get kids back into the classroom in the spring as chains of transmission are breaking off and we're coming down the epidemic curve. But after Thanksgiving, could we see more schools go to a distance model? I think we will. I think not just in this state, I think around the country, we're going to see Thanksgiving probably be a line of demarcation where 2-3 weeks from now, the picture is going to look a lot more troubling in terms of spread generally and pressure on the healthcare system. And we'll probably have a surge of infection coming off of Thanksgiving because people will have come together and will have spread the infection in small groups.
So if you anticipate that in a couple weeks infections will be even higher and schools will be forced to make that decision, would you advise that they make those decisions preemptively now?
No, I mean, I think that there are certain things we should do preemptively now to try to reduce transmission. But the things that are most important, that's what we want to preserve. And so the fact that keeping kids in school is very important societally. Children are benefiting from in-class instruction, both socially and educationally. Given the fact that we understand that the children aren't a major source of community transmission, the outbreaks aren't starting in schools. The infection's getting into the schools when you have high levels of community spread, but they're not starting in the schools. The difference between coronavirus and flu is that oftentimes with flu, the community outbreaks start in the schools, or at least are greatly exacerbated by the schools. That's what some of the literature has shown. That doesn't seem to be the case with coronavirus. And so I wouldn't preemptively close the schools. I would preemptively try to limit or close congregate settings where it's purely entertainment. So it's not a critical function, recognizing it's going to put a lot of hardship on small businesses. I don't want to be cavalier about this. There's a lot of people who work in those kinds of settings, but places that are congregate settings that aren't engaged in critical economic activity or aren't engaged in activity related to education or healthcare, that's where I would be looking to try to limit gatherings right now.
And along sort of similar lines, for Governor Lamont, several school districts now, Shelton and Sonia, I think part of the Waterbury School District, have announced that schools will be closed into January, into mid-January. I just wonder what your response is to those announcements.
Look, I'm with Scott on this. My understanding is Waterbury at least was making a big effort to keep pre-K through 5th grade open, which I think is a wise decision. Those other places, look, they can make their own mind up. There's a real trade-off, though. A lot of these kids are greatly disadvantaged, not just in terms of education, but also social and emotional, being isolated for that long period of time. So I think Connecticut did well having the majority of their schools open, as long as we have. But, You know, as Scott said, look, we're going to watch this over the next couple weeks. Thanksgiving could be a demarc point. And certainly the older age groups, we have more flexibility in terms of at home or hybrid. The younger kids, a little less flexibility and probably better if they can stay in the classroom.
All right, thank you.
Back to the Connecticut Mirror.
Hey, thanks, Max. Just a quick question for Josh. I wanted to clarify something about how the app worked. The press release said, you know, if you opt in, if you have this app, you will be notified if you were in proximity to somebody who had COVID. Can you tell me how that works on the end regarding the person who has the COVID? Does this only work if they also have this app activated?
That's correct. So the way it works is if you test positive, you get a call from a contact tracer. That's the existing process, the tried and true old-fashioned contact tracing that's worked for 100 years and we rely on heavily in this pandemic. As that contact tracer is talking to you, one of the questions they'll ask towards the end of the discussion is, have you opted into this platform? And if you have, they can then provide you with a code that you enter into your phone. And as soon as that code's entered, then it anonymously will notify anyone who you've had close contact with over the last 14 days with that anonymous notification. So that's how the process works.
Do you have any information what the experience has been in other states as far as participation in that?
I haven't seen recent data. It's still relatively early days. I think New York, New Jersey, Pennsylvania, Delaware are closest neighbors who've gone live with this, only have done it in the last month or so. So it's still in the early days.
I mean, how effective a tool do you expect this to be in the near term? It sounds like you need to really get a good base going.
Yeah, and it should be clear. This does not replace traditional contact tracing. This is a complement to that. We continue to be incredibly focused on the traditional contact tracing, and the team's been doing a great job with that. This is a complement. It's another tool. It will help if we can identify even a few dozen people who've had close contact that otherwise wouldn't have been aware and break some chains of transmission. It will help. So, but as the governor said, the more people who download and use the app, the more effective it'll become.
Thank you.
Hearst, Connecticut Media.
Thanks, Max. Hi, Governor. Could you talk to a little bit about what it would take for you to get the National Guard to start setting up field hospitals again? You made a mention of it early on today.
Yeah, I was talking to Josh about this today. I mean, the good news is, let's face it, we had a dress rehearsal this spring. We know we can get it up in a couple of days. And I think we err on the side of caution. If we find the numbers continue to accelerate in the next week the way they have in the last week, that would probably be a trigger point, just for cautious.
And is it a little easier, or there's less stress or pressure on opening them because we know a little bit more about the disease now? There are fewer people in ICUs. Maybe that's a question for Dr. Gottlieb.
I'll start with it, but then I'd love it if Scott could rescue me. But I think it is important to note that less demand upon our ICUs, which cannot be replicated in terms of the field hospital, perhaps more demand in a different demographic mix of people going into the hospitals, only there for a week, but there the field hospital can expand our capacity. Scott?
Look, I think what we've seen is that in-hospital mortality has been cut dramatically, probably in half. And the data is starting to come out that demonstrates that. And that's just owes to improvements in care. There's been some introduction of new products for remdesivir. We now use steroids more aggressively for patients who have oxygen requirements or get intubated. That's very effective. It's cutting in-hospital mortality. But a lot of it owes to just improvements in overall care of the COVID patients. And doctors, when you talk to them, feel a lot more confident now about how to care for these patients. We understand the disease much better. So if you can reduce in-hospital mortality and you can reduce length of stay, ultimately reducing burden on the hospitals, because you can turn patients over more quickly. Not as many are getting into the ICU. Not as many are staying in the hospital for a prolonged period of time. So that's going to increase hospital capacity. I think that's going to be offset nationally by the fact that we're going to infect a whole lot more people. And so even though the mortality rate from COVID might be declining and declining substantially, the sheer amount of infection that we're going to have relative to other points in this epidemic, we're going to see the number of daily deaths go up to pretty high numbers and maybe challenge the records that we set back during the wave in New York. I think in terms of just healthcare capacity, and this isn't specific to Connecticut, but just generally nationally, I think we have good capacity in the system now. Hospitals have built more resiliency. They've stockpiled equipment. We've stockpiled ventilators. Hospitals know how to implement surge capacity more easily. We know we can do it on short notice now. Where we're going to run into trouble is personnel. We're not going to have enough available personnel to move them around the country to backstop hotspots. If you remember during the epidemic in New York, a lot of medical personnel came into this region to help support the hospitals. But if every part of the country is hot simultaneously, that pool of healthcare labor that typically can move around, and there is a pool of healthcare resources that can move around from state to state, even in normal times, that's not going to be available to backstop states, and there's not going to be enough federal support to do that. So I think that's where we could become pressed, is having enough qualified personnel to staff things like ICUs, even if we're able to create the surge capacity, the physical infrastructure.
And Dr. Gottlieb, what's the research literature saying about spread in air travel?
Yeah, I've done some work with the airlines on this. I mean, it is the case that the quality of air on planes is very high. But, you know, if you have a plane with a high prevalence of infection in a high prevalence environment and you're near someone who has COVID, there's going to be a risk you can contract it even on an airplane. I think the biggest risk on a journey on an airplane isn't necessarily sitting in your seat. It's the movement. It's the, you know, taking items on the plane, moving around the plane, getting on and off, the full trip. I think people need to be aware of the risk along the entire journey, because oftentimes, you know, you'll fly somewhere, you think you got infected on the plane, and really what happened was you came into contact with someone in the airport, in the car ride, in the taxi cab. Those end up being touch points that are high risk.
And lastly, what kind of infrastructure are we going to need if the Pfizer vaccine goes to market, so to speak, with that super low temperature?
Yeah, Pfizer's provided for this. There's a box that the vaccine is going to be shipped in that has dry ice. It's been manufactured in a special way that it can keep the vaccine sufficiently cold for an extended period of time, and you can reload the box with dry ice, and so you can extend the time period that the vaccine can be stored in that unit. The reality is this isn't a vaccine that's going to be distributed like a normal vaccine where it, you know, gets shipped to a distributor like Cardinal Health or McKesson, and then it gets shipped to a CVS or a doctor's office and sits there for maybe several weeks to a month, and then it gets distributed to an individual. This is a vaccine that's going to be shipped directly from the manufacturer. In the case of Pfizer, they're not shipping through a distributor. They're going to ship directly to provider sites, and it's going to get used right away. It's going to get distributed right away. I mean, as we get into later next year, as the vaccine starts to get distributed more widely and makes its way into more primary care sites for distribution, that might be more of a challenge, because you're going to want to put it in locations where it's more convenient to get the vaccine, but they might not have enough flow to be able to use up a supply of vaccine. It comes in right now 1,000 vaccine pallets. But initially, I think this vaccine is going to get shipped and used right away. It's going to get distributed right away for an extended period of time. So it would be a good problem to have if we have so much vaccine available that, you know, we're starting to have challenges finding people to give it to.
And Governor, would you recommend that Bridgeport Mayor Joe Ganim clamp down more in light of the current hotspot, or is that still a local call?
I think he's been pretty tough on enforcement. I know he's shut down a couple of restaurants that turned into bars and some party scenes there. So I'm really thankful for that. In terms of other ways he could clamp down, I think I'd just start with enforcement. I don't think he has to change any of the other rules.
Thank you.
CT News Junkie.
Thanks, Mac. Governor, I hear you say that we should, that you're encouraging schools to stay open, and that young children aren't a vector for spread. But it seems as if a lot of districts are having difficulty staffing. Either teachers get infected or they quarantine thinking they might be infected. Districts are competing for substitute teachers. Is this something the state's monitoring?
Oh, absolutely. I've talked to Miguel, I've talked to the teachers, I've talked to superintendents about this. I'd say a couple things. One, with a new Binax test, we can test very quickly, real time, figure out whether that's COVID or not, and that means we don't have to necessarily have all those 14-day quarantines. But more importantly, I got a lot of colleges that are stopping come Thanksgiving. A lot of folks, for example, at teachers' colleges. So I'm urging superintendents to reach out to the students, the third-year students of those teacher colleges. Let them come into the classroom. Let them help out. Maybe there's an older teacher or a teacher who's quarantining for a period of time. That teacher can Zoom in, but at least you have some other bodies in the classroom to provide support and to also provide some counseling for some of these kids. So I think those that are being creative will find a way around this, but it is a concern.
Okay. Dr. Gottlieb, is there any point where do you think this might peak? The numbers keep going up here. Where do you think it might peak here in Connecticut or the Northeast?
Well, I think it's going to peak. Different parts of the country are going to peak at different periods. I mean, the parts that became engulfed earlier are going to have their epidemic peak earlier. So if you look at the Midwest and the Great Lakes region, but if you just sort of look at a normal epidemic curve and you impute some level of mitigation, that's going to slow the spread eventually. And I think that there will be more of a policy response all around the nation and a consumer response. You'd be looking at a peak at some point in January. My guess is late January we would see the epidemic peak. We're about 3 to 4 weeks behind Europe, and so if you want to understand what our epidemic curve might look like, you can look at Europe. Now, granted, the European nations implemented, I think, more strict policy measures that we're unlikely to do here, and I don't think we should have to do. I think that we have much more testing in place. We're smarter about how to target mitigation. We understand what the settings are where this virus spreads, but that's probably going to affect their peak and probably shorten the duration of their epidemic a little bit relative to ours.
Okay. All right. Thank you, everybody.
Connecticut Public Media. The Day of New London.
Hello, Governor. I wanted to ask how you think the casinos are doing in general. They say they're voluntarily adhering to the 2.1 restrictions on restaurants and so forth. And more specifically, I wonder what the state's role has been in the preparations for this college basketball bubble that'll be at Mohegan Sun in a couple of weeks, where 40 college teams from across the country are going to be playing games there for about a week, I guess, and camping out there. Has the state had a role in the preparation for that?
Yeah, let me take at least the first part of that, and Paul can help me out because he's been leading the discussion with both Mohegan Sun and Foxwoods. Look, I'm very thankful. Neither of them have gone up to 50% capacity. They've kept the capacity down. They've been very strict in terms of infection standards and the such. A special thanks, I believe, to Mohegan Sun. Like us, they've said those restaurants got to stop serving at 9:30, close down at 10 o'clock. What a difference that makes. But Paul, do you want to speak to that?
Yeah, Governor. Just to piggyback on that, I want to thank the Mohegan Sun for agreeing to take that action. Even going further, as we've been told, of taking a vote of their tribal council to increase enforcement as well. So we want to thank them for collaborating with the state of Connecticut on those actions. When it comes to the bubble, our office, as well as the Department of Public Health, has been staying in close contact with Mohegan Sun as it deals with their preparation and planning of the bubble. As the governor has stated previously, as it deals with sports, a bubble environment, as we have seen on a professional level, is a great way to make sure that they are keeping everything contained. But understanding that there will be travel that will come in from the state, from individuals who are from colleges outside the state, as well as personnel, we are going to be staying in close contact with Mohegan Sun and their public health teams as final preparations are made.
Okay, thank you.
The Waterbury Republican American.
Thanks. I'd just like to clear up something with Dr. Gottlieb. Were you saying just a moment ago that you expect a peak in Connecticut in late January or a peak in the country? I wasn't quite sure what you meant.
Yeah, I think you're going to see the peak of the epidemic curves generally at some point in January in the country. And I think the nation sort of, if you do the nation as a single curve, which we really shouldn't do, because these things do get regionalized, probably late January we'll be hitting the peak number of infections. We'll be going up the epidemic curve through the end of November into December. We'll peak some point in January. That would be a sort of normal process, 6 to 8 weeks of continued growth and spread. We're really at the beginning of the steep part of the epidemic curve right now. So we have a difficult, 4 to 6 weeks ahead of us. You look at Europe, we're about 3 to 4, I think most people accept we're about 3 to 4 weeks behind Europe. Look at the curves today that were posted on Twitter and elsewhere, looking at hospitalizations per capita in the US relative to Europe. We're following the same trajectory. We're just behind by 3 to 4 weeks.
Okay, thank you. Governor, I thought at the beginning you said the response rate for contact tracing was 98%. Is that correct?
I think that's right, isn't it?
So
Josh?
we've been successfully reaching out to 98% of new cases within 48 hours. In fact, last week we hit an all-time high since we started this, despite the significant growth in cases. So the teams have been doing a phenomenal job keeping up with that. And then we've been successfully able to reach and interview about 2/3 of those people. So last week it was 65% of those folks we reach out to, we were able to connect with. And from what we can tell, benchmarking with other states, that's a very successful ratio. So again, hats off to local health department partners and our team at DPH who are doing a great job there.
And what is the in-hospital mortality rate in Connecticut? You guys are no longer providing the cumulative numbers of discharges and hospital admissions in your reports on Thursday. So that number we can't really try to keep a track on. So can you please tell us what it is?
We provide that chart from time to time, and since you asked, Paul, we'll make sure we get it in maybe next week. I don't have the very latest at my fingertips, but it's a single-digit number of patients who are admitted who then ultimately, pass away in the hospital. We'll get you the exact data next week.
Okay, I appreciate that. And in terms of, Governor, you spoke about the schools and infection. I know we covered a lot of territory on that, but I was just looking at the numbers this afternoon. The cases, the total number of cases among the 9 and under age group went from 949 on September 1st to 2,178 on November 10th. And there's been, that's about slightly more than, twice. And there's been a nearly 3-time increase in the number of cases since September 1st among the 10 to 19 age group. So doesn't that show that there is significant spread happening in our schools, whether or not it's students that are in classes or learning remotely?
What it says is, I've looked at the numbers, those that get in school full time, maybe 20% of them, that's where some of that increase was, but you were much more likely to have gotten infected if you weren't in school full time, either hybrid or all remote. But that's false comfort. Obviously, the rate is going up for all demographics, including young people. But what Scott was saying is, at least among young people, especially the youngest people, much less likely you can get infected, but less likely to have suffer real consequences from it, and much less likely to be infectious. That's what was the important point there.
Okay, thanks. And just one last question for me, and I guess it would be for Josh. You mentioned that you added 30 new testing sites. We're about more than 200 around the state now, increasing weekday and weekend hours. How were the 30 additional sites allocated? I mean, how did you figure out, okay, we need more testing here, so we're going to help establish new testing capabilities in these particular communities?
Sure. Well, it's working with our testing partners, the federally qualified health centers, our hospital systems, and other private partners that we have who are doing the actual testing. And we're working with them to identify where the needs are, where we're seeing increases, making sure we have geographic coverage as much as possible around the state, including in some of the tough to reach corners. So it's an ongoing process. We're working with the local mayors and first selectmen where they see gaps, and so we're in constant dialogue with all those folks to make sure we're getting testing out to everyone who needs it.
And I'd like to just add one thing, well, Josh, while we have these testing communities set up in a city or a municipality, it doesn't mean that that testing facility is only for the residents of that city or that municipality. It's about making sure that we're putting testing facilities, working with our various partners in a large enough radius that will make sure that it's accessible and available for all that need it within our communities in Connecticut.
Okay, thank you very much.
The Associated Press.
All right, I'm getting the signal. Special thanks to Scott Gottlieb. Scott, I really appreciate you joining us again and all the advice you've given me and our state over the last many months. I'm a baseball fan, so I took to heart 8th inning. That means something to me. I know some innings are longer than others. I know a lot of games are won in the 8th and 9th inning. I know it means a lot of you are really frustrated. We've been through this before. Here we go again. I don't know if I can do it. But when I hear 8th inning, I know this is the time you buckle down. This is the time we know if we get it right as a state. We are going to get to that January time frame where we're bending a curve. That's what I heard when I heard 8th inning. I heard a lot about the therapies that are coming along and the vaccinations that are coming along. We just got to stick to it a little bit longer. I know, only 6 people at Thanksgiving. Well, just this one time, or I got to Zoom learn for a little bit longer, just this time. And this is, if you know that there's a light at the end of the tunnel, that's where we're going, and that's what I heard when I heard 8th inning. In the meantime, what can we do as a state to do everything we can to contain the virus? You heard a lot about our track and trace app, the one I said even I was able to get on my iPhone. Here's a little video to give you a heads up. Take care, everybody.